what I've been doing is just taking that end off, and that'll be my 0 point, okay? For depression, lateral, and retrusion or protrusion. So again, and then we found a couple in the other lab, but when you're doing your active range of motion assessment, see if you notice any deviations. So you might see a C, like, so if anybody has TMJ issues in here, you might see a C where it deflects to one side. And we also saw an S pattern where it kind of judders, and that's more of like a neuromuscular control. So a room this big, we'll probably find one in here. If you find it, let's point it out, and we can all look at that as well too. So again, we're going to be doing our. I'm going to show you the measurement, and then we're going to go over the passive range of motion after that. So for depression, what you're going to do, you're going to have the patient facing forward. I'm going to do it from the side, just so that you guys can see. But the 0 is going to be at the center of the top 2 teeth, and then you're going to measure down to the center of the bottom, the top of the bottom 2 teeth. So I'm just going to have you open, okay? And so I'm going to have that right there at the top of those teeth, and then I'm going to move her lip out of the way just a little bit, okay? And then I'm just going to be measuring from the top of that to the top of the bottom teeth, okay? For lateral, what we're going to do, you're going to be measuring the center of the front 2 teeth to the center of the bottom of the bottom 2 teeth. Okay, so again, I would be in front, but the 0 is going to be at the top of those teeth. You're actually going to not open that much. You're just going to open just a little bit. Okay, and then you're just going to come to kind of, yes, just like that, coming to the side. So I'm going to have the 0 starting in the middle of the bottom 2 teeth, and then I'm going to measure over to the top 2 teeth, okay, for that. And then you'll measure side to side. And then for protrusion, so you're just going to stick protrude your bottom lip forward. Go. Good. Good. So she doesn't have a lot of protrusion there. Somebody else.